Hi, I'm Dr. Rebekah Gee, and I'm the winner of the Warren H. Pierce Health Policy Award this year. I'm an assistant professor at LSU in the Schools of Public Health and Medicine, and I had written the award to study the issue of interconception care in Louisiana. Louisiana ranks in the 47th out of the 50 states as the worst health in the nation. We have some of the highest burden of chronic disease, some of the worst birth outcomes. We have among the highest infant mortality, among the highest preterm birth, among the highest burden of all disease, some of the shortest lifespans. In fact, among our African American population, the lifespan is shorter than that of people who live in Colombia, South America, Venezuela, and Vietnam. So we have tremendous health challenges. One of the things we know, because Louisiana has some of the best access to prenatal care, is that access to good prenatal care can't undo the effects of chronic disease that occurs into a woman's body over the course of her lifetime. So even if a woman has good access to prenatal care, you can't change the effects of hypertension, of diabetes, of obesity, of chronic stress and depression, all within just the confines of prenatal care. And so what we're trying to do in Louisiana is find new ways to deliver care. 90% of our African American patients in Louisiana deliver on Medicaid, but often those women are dropped from care within less than 2 months after delivery. And so they end a pregnancy and don't have their chronic conditions managed. And then obviously, in the absence of coordinated care and good family planning, often they come back with either an unintended or intended pregnancy, but without those conditions managed well. And so what we're going to do in Louisiana is going to be called the Birth Outcomes Project, and it's being supported by our governor, our Secretary of State, and by numerous partners, is to help to change these statistics. And what our plan is to do three things: to look at things that hospitals can do and physicians can do to improve birth outcomes, things like not inducing a patient to deliver a baby too early when it's not necessary, and giving medications like 17-hydroxyprogesterone that can help decrease the levels of preterm birth. We're going to look at things like Medicaid. What are we paying for in Medicaid? How are we providing care to our highest risk individuals? And how can we do that in better ways that coordinates the care, that allows women to have a care coordination team, that women know who are high risk, that they have someone to call, to think about new ways of care delivery in ways that will improve outcomes. And the third is to think about programs, things like resource mothers, care coordinators, to help get women into care and help support them through their future pregnancies and through the period in between their pregnancies. So our plan is, and thanks to ACOG, I'll be able to study this to look at how can we improve these outcomes in Louisiana so that hopefully in 10 years from now or 20 years from now, Louisiana can be the best in the country and everyone can look to us about how it's done and how to improve birth outcomes, because without healthy babies and without healthy mothers, really the future is not secure. And so this is a priority for Louisiana, and I'm very excited that ACOG is joining me in this journey to help improve our birth outcomes. Thank you.